Hi guys, welcome to Module 5, Day 2. I know that this week we really were focusing on Chapter 36 and Chapter 11. And in the Day 1 video, I had already talked to you guys about Chapter 36 and what it was all about. And normally, you guys are used to in the Day 2 video, I talk about the second chapter. Unfortunately, this week it's going to be a little different. Now, normally I can relate the second chapter to what we'll be doing in the lab class. This week, that's not exactly what's going to happen. Chapter 11 is really dealing with the written communication and how those forms of communication come across. That's not something we'll be practicing in the lab, so I don't want to take time during this Day 2 video to talk about that. With that being said, I do want you guys to still read that chapter in full on your own. And then if you have any questions, you can either bring them to myself or your lecture instructor, and we can help guide you and direct you in the correct way. I don't want you guys to think that I'll be leaving you high and dry for this video. I do still have things I want to talk about. The main focus for this week in the lab on Day 2 will be dealing with health maintenance. I'm sure you've got a lot of questions about what exactly that is, so let's talk about what is health maintenance. Well, really, it falls under the electronic health record. It's part of that EHR. And what it is those alerts that will go out when patients are due for upcoming procedures, physicals, immunizations, lab work, maybe they need medication refills. All of those things are part of those alerts that will fire off. So your job as the medical assistant is really to make sure that those items are being met or being fulfilled. So that way we give the patient the best treatment possible. For example, we know that flu shots are given every year on an annual basis. You have a patient coming in who you see has not had a flu shot since 2012. So they're overdue. So what you would do is, in the best interest of the patient, when they come in for that appointment, notify them that they're due for that flu shot, see if they are willing to get that, and then notify the provider so he can order it. Pretty much that's what health maintenance is. Now, you might also be responsible for providing an ICD-9 code. So, ladies, that means that this week we will be looking at those ICD-9 books, and we're going to figure out how to get a diagnosis code for a disease or maybe a procedure. So I will have you guys broken into different groups and have you working with those ICD-9 books all together. So the other part to health maintenance, like I said, is really making sure you're doing what's best for that patient, but also for the provider. And that can be something as simple as setting up refills for the provider to sign. Now remember, we as medical assistants cannot actually sign that order, but we can set it up for the provider, so all he has to do in that EHR is sign off on that refill, and it goes directly to the pharmacy. But I guess it's really important, how do you know when it's time for a refill? So there's two ways that you can know when a refill or a medication is due for a refill. Number one, the patient will come in and tell you, hey, I'm out of this medicine, I need a refill. Maybe doctor only gave them enough to get them to that next appointment. So then you can set up that refill for the provider. The second way is actually looking at the medications in the chart and being able to read how many the patient was given and how many refills, and then doing those calculations to see how much that patient has. For example, let's say you have a patient who takes metformin, 1,000 milligrams, 1 tablet daily. So the provider ordered 30 tablets with 3 refills. Now 30 tablets is a 1-month supply for that patient because most months have 30 days. So those 30 tablets, it takes one a day, is a 1-month supply. Our doctor gave them 3 refills, so that means they have 3 more months on top of that, making that so they have 4 months worth of medication. And after that 4 months, then they will be due for a refill. I know that seems like a very daunting task to figure out, but I promise you, once you get going with it, it's very easy to do those calculations. Alright guys, so you can refresh yourself and look back on the health maintenance. It's part of the electronic health record chapter from last week, which was chapter 14, I believe. And if you have any questions, we'll be talking about this on day 2. Have a wonderful day, guys. Bye-bye.